Hi everyone. So hearty welcome to NVS demo session. So this is Dr. Y. Kalyan Kumar. So before going to start our session, so I would like to convey my sincere thanks to my gurus and my parents. And today we are going to discuss about the NVS examination pattern. So exactly the Kyati Study Circle is going to establish a new phenomena in teaching, that is a virtual board. So actually the NVS Navodaya Vidyalaya Samithi is going to organize 150 marks of examination. So this is 150 marks. So we are going to get 180 minutes of time. So that we have to you have to write the examination within 180 minutes of 150 examination bits. Within that, so what kind of material we have and what kind of syllabus we have, that we are going to discuss right now. So here the NVS has divided into this examination pattern into 6 parts actually. So these 6 parts consisting of, so part 1 is general awareness, and part 2 reasoning, and part 3 aptitude, and part 4 ICT, that is information communication technology, and part 5 is domain, our subject, domain content, that is our respective subject, and part 6 is compulsory language competency, we can call it as a language competency. So within that we have again English, Hindi, as well as respective regional language. So out of these, so these are the 6 components we have to write the examination. Out of these 5 are different and this 6th one is a very important area. This is a qualifying, just like a qualifying examination. So out of this, each and every part is carrying 10 marks. That means general awareness is carrying 10 marks and reasoning is carrying 10 marks. Teaching aptitude is carrying 10 marks. ICT is carrying 10 marks. And 5th, our respective subject is carrying 80 marks. And remaining part 6 is carrying language competency, we can call it as a language competency. So in this competency, we have to qualify the examination of English, Hindi as well as regional language. Out of this, out of 30 you have to get 40% of marks in each and every subject. So that is most important for NVS category. So right now, Kyati Study Circle is going to give you a very good coaching for the 2 to 6 parts, except general awareness. We are not giving any type of coaching for that. But rest of the things, that means part 2, part 3, part 4, part 5 as well as part 6 also we are providing coaching for you. Stop this. So here the part A of part number 5, you have to go for our subject content, that is called physical education. In this, the part A is consisting of concept of physical education. In this, meaning and definition of physical education here. So, and the aim and objectives of the physical education, aims and objectives of physical education, and modern concepts and scope of physical education, as well as need and importance of physical education and place of physical education in the total education process. So according to this part A category, part number 1, so we are concentrating on concept of physical education. That means we are consisting of aim and objective, scope, everything you have to go through with this syllabus. And next one is here some examples of this question according to the concept of physical education. Who amongst the following expresses the physical education is an integral part of education? So this is one kind of important question for the part A in category 1. So according to this, so expressed the physical education is an integral part of education. This is most important area. So who said this means? So Charles A. Booker said this. And according to Obertford is delivered as the physical education is some of those experiences which come to the individual through the physical movement. So that is the most important area. So everybody has given their own definitions regarding this physical education. So according to this question, who amongst the following express that physical education is an integral part of education? So this will comes under the concept of physical education. And again one more question for your reference. And which of the following will not come under the scope of physical education? See, this is the scope of physical education. So which of the following will not come under the scope of physical education? So the options are the cleanliness of program, fitness and recreation program, and service program, as well as intra and extramural program. So in the scope of physical education, so fitness is compulsory, recreation is compulsory, services program means it is indefinite thing. So you have to go through with this, the service program you can apply for anything in physical education. So intramural and extramural, this is also one of the scope for us, and except the thing is cleanliness program. So the question is what they are asking. So which of the following will not come under the scope of physical education? So fitness and recreation will come, as well as service program will come, and intramural and extramural program will also come. So the program of cleanliness program will not come under the scope of physical education. Right. And we will move to next question. And another important question regarding the concept of physical education, meaning and definition, everything. So physical education as well as a sports experience, a golden era in which ancient country? So they are asking about the golden era for physical education. So we can call it as straight away, the Greece is the answer. For this golden era, we can call it as a golden era for a sport. So that is in ancient times, we can call it as Greece. And the essence of physical education, another important area of the question, the health, gymnastics, physical activity, games and sports. So here they are asking the essence, the importance, the overall concept of physical education coming under the physical activity. So it is depends upon the age, ancient times to evaluation process. So that we will discuss in our class in detail. So this is about the first question. And part A, category number 2 is dealing with the physiological aspect of physical education. So here in this area, so we are going to know about the effects of exercise on muscular system, circulatory system, respiratory system and the digestive system. So these 4 systems we are going to cover in this area. So physiological aspects of physical education. So in that category we have only 4 systems as per the NBS syllabus. So that is muscular system, circulatory, respiratory and digestive system. Alright. And the question here for that 4 options, we have one question. So both systolic and diastolic blood pressure can be lowered to a modest degree with the program. So here the modest degree with a program of where the systolic diastolic blood pressure can be lowered. So where you can lower, how you can lower these two aspects means systolic means it's a contraction, diastolic means it's a relaxation, right? Right. So cannot be lowered. The options are the cannot be lowered, or plyometric type of exercise can lower the systolic diastolic, or the aerobic type of exercise can reduce the systolic and diastolic blood pressures, as well as the anaerobic type of exercise can reduce the systolic and diastolic pressure. So as per the research, so aerobic type of exercises can reduce these systolic and diastolic pressures. So this is one type of question they are asking for the examination point of view. And third part, so this is the psychological aspects of physical education. In this part A, psychological aspects of physical education, in this definition of psychology and sports psychology, achievement and motivation in sports, and sportsmanship and sports ethics. So these are the two new areas when compared to the regular DSC or some other patterns, right? So these kind of things in this achievement and motivation, this is very much important in sports, and there are so many questions in areas and careers they are asking, and including with the UGC net and set also. So here the Maslow hierarchy needs of theory and Hesberg's theory, such kind of motivational theories, achievement theories we are going to discuss in this chapter. And psychological aspects, what kind of psychological aspects in connection with the physical education, and what is meant by the sports psychology, and how it is influenced, how it will be influenced to the sports, so that we can discuss straight away. And the questions from this psychological aspects. So after loss in a competition, accepting defeat in a positive manner is an example of. So after loss in a competition, so accepting defeat in a positive manner is an example of whether they are accepting their loss in a positive manner, what we can call it as. So is it called as an introvert, or you can call it as a sportsmanship, or you can call it as a defaulter, or you can call it as a loser. Of course they are the losers, no issue of that. But in a positive manner, so we have to call them as a sportsmanship. This is the answer for this question, because so any kind of positivity, whether you are winning or losing, so this is the sportsmanship is most important, whether you can win or lose. So that is the basic concept of sport. So fairness, another question in this area, psychological area. Fairness, integrity, responsibility and respect are the four key virtues of fairness, integrity, responsibility and respect. So 1, 2, 3, 4 are the key virtues for what? So whether you can call these four coming under the sports ethics, fair play, group cohesion or the sportsmanship, isn't it? So it is coming under the sports ethics. So you should follow the ethics of sports in each and every aspect. So every game as sport means you have to play with ethics. So you should not go for the abuse of the opponents or some other areas, and you have to maintain some sportsmanship in all ways, right? So this is about another important aspect. And part A, physical fitness and wellness. So this is another important and regular for the regular area of physical education. We know what is meant by the physical fitness, and we don't know in wellness. So here the NBS is focusing on wellness, and there are so many questions regarding this. So what is mean by the wellness? So here they are giving the prescribed syllabus as meaning and importance of physical fitness and wellness, and components of physical fitness and wellness, and factors affecting physical fitness and wellness, principles of physical fitness development, means of fitness development, aerobic activities, jogging, cycling, calisthenics and rhythmics, and exercises, and participation in games and sports, as well as the circuit training, right? So these are the parts in this physical fitness and wellness. So wellness, so there are so many wellness factors available in our society. So it is a combination of physical and wellness. Wellness means some physical, body and the spirit. So these are concepts of wellness. So wellness is nothing but mental wellness, occupational wellness, physical wellness. So everything will coming under this area. So financial wellness, everything. So we will discuss about the wellness factors here. Next one. So this is a question from this physical fitness and wellness. So which of the following factors does not influence the physical fitness and wellness? The question is, which of the following factors does not influence physical fitness and the wellness? So which of the factors? So that means age, gender, climate and the angle. So which factor will not influence the physical fitness? This is one type of question. So whenever you are talking about, so gender will influence, yes. Age will influence, yes. Gender will influence, yes. The climatic conditions may influence the physical fitness factors, but the anger will not influence any kind of physical fitness. So the answer is the fourth one, alright? And which of the following is not a health related physical fitness components? You know, everyone know about the physical fitness components divided into two areas: skill related physical fitness and health related physical fitness, right? So here there are speed, agility, endurance, body composition, flexibility, reaction time. This will comes under the skill related physical fitness components, and health related physical fitness components are muscular endurance, cardiovascular endurance, body compositions and strength endurance. So these are the health related physical fitness components. So out of this, which of the following is not health related physical fitness concept, right? So components: cardiovascular endurance, yes. Body composition, yes. Flexibility, yes. So the option remaining is agility. So agility will coming under the skill related physical fitness component, right? And which muscle contraction causes no change in muscle length? I think we moved. Yeah. So training methods. So in this part A, the fifth criteria is the training method. So meaning and concept of training, warming up, limbering down, and their importance, methods of training, methods of strength development, isometric, isokinetic and isotonic also we are going to discuss. Methods, endurance and development, the continuous method, interval training and fartlek, methods of speed development, and this is coming under the acceleration runs, pace races. So here we are going to discuss about all those areas in the training methods, right? The question from this area, so which type of muscle contraction causes no change in muscle length and no joint or limb motion? So here they are asking, while contraction occurs, there is no change in muscle length and no joint or limb in motion. So they are asking about isotonic, that means it is a dynamic. Here you are having this eccentric and the concentric, right? Isokinetic speed, right? Ballistic contraction, this is no way concerned to this one, and the isometric contractions, there is no movement, but the tense will be there. So the option is the isometric contraction. So limbering down exercise helps to another area according to the syllabus. Limbering down exercise helps to. Limbering down is nothing but warming down. It is nothing but warming down or cooling down, right? So limbering down helps to reduce tension and nervousness, rise the core body temperature, improves the coordination, prevent post-exercise soreness and stiffness. So according to this limbering down, it won't reduce any kind of tension, either it may be a physical or it may be a spiritual or it may be a mental. So it won't get that kind of nervousness, or this is the wrong option. And the rise the core body temperature, no, this is also wrong one. And the improves coordination, no. And the exert, the purpose of limbering down is to prevent post exercise. Post exercise in the sense after exercise. So after exercise, that will reduce the soreness and the stiffness. So according to the accumulation of the lactic acid, so that will be removed by the limbering down. So this is the right option. Option 4 is the right option. And the syllabus for physical education part A, the final aspect of part A is sociological aspects of physical education. So meaning of sociology and its importance in physical education, and games and sports and the cultural heritage, development of leadership qualities and the group dynamics. So here another important area, sociological aspects. So how the sociology aspects will take a contribution towards the physical education. So until unless the evaluation process has been taken into the existence, so sociology is playing a vital role. So we will discuss seriously and elaborately in this aspect. And some of the questions regarding this process of development, group dynamics, inclusive 5 stages. And exactly as per the some of the books we have only 4, but the latest they are giving 5 stages for the correct sequences, right? So storming, conforming, performing, forming, and the second option, third option. So this is the forming and storming and conforming, performing and adjourning. So these are the 5 aspects to develop the group dynamics, inclusive the 5 stages, right? And this is the part B. So history of the games and sport. So this is another important area. In part A is consisting of 6 parts, and part B is consisting of this area. And this is looking very simply, but if you elaborate this one, so latest general rules of the game and measurement of play fields and specification of sports equipment, the fundamental skills of the game and sport, related sport terminologies, important tournaments and venues, sports personalities and sports awards. So these are the important factors in these games and sports part B criteria. Another important factor to score the maximum marks in this area. So a question like this, they may ask like this: in July 2019 became the first Indian ever to win gold medal in the 100 meters race at the 2019 Summer Universiade. Please make note, Summer Universiade. So university sports held at worldwide Napoli, Italy. So that is none other than our sprinter Dutichen. Right. So who invented basketball? So this is very regular question for you, and you know everything. So James Naismith, right? So another important area question: since when has swimming been an Olympic sport? So whether it may be from the initial stages, from the first Olympics, it is swimming has been initiated from the 1896. In an official FIFA match, how many substitutions are permitted? So this is the first time we have given the right this thing. So everybody feels that there is two, but we said this is the three. So this is the three options are correct. And which of the following weight and color combination for the discs or the plates used in weightlifting is correct? So already this is also we expected from that NVS coaching time. So this is the bit as it is bit. I think it is in the 2019 NVS. I think if I am correct. So this is this bit in 2019 NVS. Right. So our teaching faculty for the games, and we are happy to introduce our games teaching faculty. Athletics discussed with Sudha and Ramohan. And badminton Reddy Shivakumar, and basketball Rajshekhar, cricket Nagchiti Babu, football Nagaraj and Azazullah, and gymnastics by Kalyan, kabaddi Sudha, and Kho Manjuna, and hockey Vamshi Krishna and Mahesh, handball Srinivas, and softball Nagchiti Babu, swimming Manjunath and Vamshi, tennis by Kalyan, volleyball by the Shabir Ahmed. So most of the people completed their NIS in their respective games, as well as everybody represented for more than nationals for more than 3 to 4 times in the senior nationals, I think, right? And then so health education, we have 6 units again. The health education, the concepts and objectives of health education, importance of health education, principles of health education, importance of community participation for health promotion and welfare, individual, family and community. 30 minutes. So communicable diseases, another second area for the, in health education. So communicable diseases, essential conditions for communicable diseases to occur and diseases process. Common alert signals indicating onset communicable diseases and mode of transmission, common symptoms and prevention of spread transmissions, hepatitis B and hepatitis C. So this is also communicable diseases part. So this is one of the model question. So which from the hepatitis was initially called serum hepatitis? So which of the hepatitis was initially called serum hepatitis? So that is serum hepatitis, we can call it as the hepatitis B, and hepatitis affected in liver, right? So this is another important aspects. And third part in this part C, contemporary health problems. So alcohol, the effect, abuse of alcohol, tobacco and drugs. This we are going to discuss it in detail, and everything under this category, so related to sports performance. So definitely there would be so many questions regarding this. Eating habits that cause obesity, So you will get a question from obesity. This is we are looking that obesity is very simple factor. No, this is a very big issue in sports arena and nowadays the wellness management, right? Question from the drug side. So diuretics are drugs that are used. Diuretics. So lower blood pressure, enhance concentration, delay fatigue, and increase the threshold capacity. So according to this, the lower blood pressure is the diuretics main area. So use it to lower the blood pressure through the diuretics, right? And anabolic steroids acts on the system. So this is straight away works on the muscular system. If you remember Ben Johnson, the sprinter who uses anabolic steroid, right? Okay. And part C, the health aspects, healthful living, and we are going to discuss each and every area of this one. So components of environment, workplace environment, essential elements of health, low level of radioactive radiations, the home and neighborhood in rural and urban areas, school and workplaces, during the leisure time activities, recreation and sports. So another important area for the leisure time activity, the physical education concept has been evolved based on this leisure time activity, right? So we are going to discuss all those things in that area. And this is the family health, fifth area. So meaning and functions of family and importance, needs and problems of adolescents and their management, human reproductions, and menstruation, conceptual and prenatal care, and problems associated with the premarital sex and teenage and pregnancies, preparation of marriage, role, parents in child care. So another important area in family health education. So there are nearly in this unit, so you are getting more than 2 questions from the reproductive system, right? So sport, and 6th criteria in part C, prevention and first aid for common sports injuries. So we are going to discuss about the soft tissue injuries and bone injuries. Soft tissue injuries means strains, internal aspects, and bone injuries, joint injuries. We are going to discuss in detail, very elaborately regarding the tissues injuries. Bone injuries means fractures. Everything we are going to discuss in this aspect. The question, which of the following is not a method of endurance development? So interval training, so training methods means, so which of the following is not a method of endurance development? So interval training method will develop the endurance, fartlek, nothing but speed play, but even though it is develops the endurance capacity, and continuous method is also develops the endurance capacities. The option is the pace races, and the lateral epicondylitis is also known as, so this comes under the injury part, and lateral epicondylitis is also known as the tennis elbow. Kyphosis is a different aspect, and lateral spine and bowlegs, these are the deformities, but only the injury aspect, lateral epicondylitis, means this is called the tennis elbow. Alright, so I think we covered all the syllabus process in this. Dash is a trauma that has been caused to a muscle due to overstretching and tearing of muscle fiber. So this is a wound, we can call it as a wound or cramp or strain or sprain. So whenever there is a muscle fiber tearing, whenever the muscle attachments may be tear because of the strain, not because of the sprain. So because bone connects with the muscle, that is called the tendon. So all the tendon injuries comes under the strain. So again it is divided into three areas. So grade 1 and 2 and 3. So these are the aspects. So we can call it as a sprain. This is called the ligamental injury. Alright. So this is called the sprain. So bone to bone. Right. Okay. And thank you for your patience listening, and I hope if you like this class, so definitely you can join with our link that will be posted very soon. So our class interaction will begin from 23/7/2022 onwards. So I wish you all the best. The Kalyan Kumar is signing off. Thank you.